One of my sisters was born with some medical issues, and I remember as a young child and early teenager going with her and my mom to various doctor's appointments and really appreciating the compassion and the care that she received. I really looked up to physicians and the care they provided my sister, and thought that that would be a great field and a great place to pursue my career. I am Jim Flynn. I am a board-certified orthopedic foot and ankle surgeon. I am board-certified in orthopedic surgery and fellowship trained in foot and ankle. So my specialty, my elective practice focuses on the ankle and foot, really anything below the knee. It covers everything from ankle replacements to bunions and everything in between. Orthopedics was always an area that held an interest for me due to sports medicine and my ability to be around sports teams and athletics. But I found myself when I was in the operating room, and particularly when I was around other orthopedic surgeons, feeling again like this is like home. I love seeing my patients get better, to walk with them on their journey from when they come in, whether it's an acute injury, that broken ankle or an Achilles rupture that just happened, and walking them through their journey of recovery, or if it's for a patient that's been dealing with something like arthritis for a long time, and we built a relationship over several months and several years sometimes. Ultimately, when it comes time to having something done to fix their problem, walking them through that journey and seeing the results when they're all finished, I'm so passionate about that. Patients need to know I care about them. I truly do. When they come to see me for an appointment, they're going to get my full undivided attention. I'm going to listen to them. I'm going to try to understand not only their physical problem, but how it affects their daily life.